We are from Family Planning Association of India, Nagaland branch. Our headquarters is in Mumbai. We are celebrating 75 years anniversary. And since 2023, as per Nagaland branch, since 2023 and 2024, we are venturing, or rather, the correct term would be going into humanitarian response activities as well. As per the name Family Planning Association of India, we work for family planning, and with the passage of time, we realized the importance of sexual reproductive health, and so we have committed ourselves to sexual reproductive health services. And today, this press meet is basically to update the media and the public on the humanitarian response activities that we have been doing. I have a script here. I will read out this one so that I will spend less time. Family Planning Association of India is a pioneer organization in sexual and reproductive health in India, working since 1949 to advance the right to sexual and reproductive health information and services for all. FPA India provides a wide range of services including family planning, HIV prevention, maternal health, and adolescent sexual health education. The global humanitarian crisis displaces about 34,000 each day due to natural hazards, climate change, and armed conflict, epidemics, complex emergencies, etc. Women and girls' need for reproductive health care is not suspended in crisis. 1/4 of people affected by crisis are women and girls aged 15 to 49. 1 in 5 women are likely to be pregnant, and 1 in 5 of all deliveries will experience complications. In crisis settings, there is also a heightened risk of early marriage, rape, and sexual violence, unsafe abortions, unattended births, sexual gender-based violence, and unintended pregnancies. Transmission rates of STIs, including HIV, increase in emergencies. Adolescents may feel fearful, stressed, bored, or ideal. They may find themselves in risky situations that they are not prepared to deal with. Such situations. Very young adolescents, 10 to 14 years, especially girls, are at risk because of their dependence, lack of power, and their lack of participation in decision-making processes. They may not recognize the sexual nature of abusive, exploitative actions. At this situation, there is urgent need for access to confidential and safe sexual and reproductive health services and referral pathways. In such a situation, there is a breakdown of mechanisms for protection and service delivery. At this situation, there is urgent need for access to confidential and safe sexual reproductive health services and referral pathways. The Family Planning Association of India has played a crucial role in addressing humanitarian crises over the country, across the country. Though its implementation of the Minimum Initial Service Package, MISP, for reproductive health, FPA India has provided vital support to vulnerable populations affected by natural disasters, conflicts, and other emergencies. MISP is an internationally recognized set of priority actions designed to address reproductive health needs during the onset of a humanitarian crisis. It focuses on preventing excess maternal and neonatal mortality, managing sexual violence, and ensuring access to contraception, among other essential services. FP India has integrated MISP in its emergency response framework, ensuring the continuity of SRH services even in the most challenging situations. In recent years, FP India has successfully implemented MISP during several critical humanitarian crises. Floods and cyclones in regions hit by severe floods and cyclones such as Kerala, Bhubaneswar, and Odisha. FP India deployed rapid response teams to ensure that reproductive health services are not disrupted. These services included providing safe delivery kits, ensuring access to contraception, and offering psychosocial support to survivors of gender-based violence.
I'll be addressing on the Emergency Preparedness Plan. The Emergency Preparedness Plan is essential because it ensures that individuals, communities, and organizations are ready to respond swiftly and effectively when disaster strikes. By having a structured plan in place, risk can be minimized, lives can be saved, and the impact of disasters such as natural calamities, pandemics, or accidents can be significantly reduced. Preparedness includes identifying potential hazards, creating communication strategies, organizing resources, and most importantly, outlining clear roles and responsibilities. This helps in reducing confusion, panic, and delays during emergencies, leading to a more coordinated and efficient response. Moreover, emergency preparedness builds resilience. When communities are prepared, they recover faster and are less vulnerable to future risks. It promotes awareness and educates people on how to protect themselves and others, fostering a culture of readiness. Sexual and reproductive health SRH services, along with addressing sexual and gender-based violence, are critical in emergency situations during disasters because vulnerabilities increases significantly during crises. Disasters often disrupt healthcare systems, leaving individuals, especially women, adolescents, and marginalized groups without access to essential services like contraception, maternal care, and treatment for sexually transmitted infections, STIs. This lack of access can lead to an increased rate of unintended pregnancies, unsafe abortion, and maternal mortality. Providing sexual reproductive health services ensures that people's basic health needs are met, helps prevent life-threatening conditions, and upholds your dignity during difficult times. Additionally, disasters exacerbate conditions that can lead to a rise in sexual gender-based violence, including domestic violence, sexual assault, trafficking, and exploitation. Displacement, overcrowded shelters, lack of law enforcement, and the breakdown of social structures make vulnerable populations, particularly women and girls, more susceptible to violence. Addressing sexual gender-based violence in emergencies through prevention, protection, and response services such as safe spaces, legal assistance, and psychological support is vital to safeguarding their health, rights, and well-being. Integrating sexual reproductive health and gender-based violence in emergency responses not only addresses immediate health risks, but also promotes resilience and recovery for affected communities.
Tell you that Family Planning Association of India's Humanitarian Response. We are not first responders. The first responders are basically the people from NDMA, SDRF, or all these authorities that are concerned with first response. But when there is an emergency or when there is a disaster, people, normal life is disrupted and people are shifted to camps, relief centers. And with the example of Manipur armed conflict that we have witnessed, it is seen that people live there for months together. And it is this time that sexual reproductive health services are crucial and important for people displaced internally and living in relief centers. And the team that we normally conceive of is a doctor, nurses, lab technicians, counselors, and of course volunteers. So that, and there are times when language communication becomes a barrier, so we need interpreters as well. But whenever we conduct health camps, we see to it that confidentiality is maintained, so that each individual, have a private counseling session or OPD session, or even the disbursement of medicines are to be seen as private. Otherwise, many assumptions come, and we can't allow that to come in a relief center as well. So those are the things that we'll have to keep in mind. There are also these principles of neutrality, impartiality, non-political, and being independent. Non-political, neutrality, impartial, and independent. Those are, four principles that we follow when we go to conduct our health camps or sexual reproductive health services with the displaced persons in relief centers. Fortunately, Nagaland is prepared with the kind of exercises, mock drills that we have been observing. But should there be a disaster beyond the control of the society or the mechanisms that is in place, then Family Planning Association of India has the resources to be able to activate its rapid response team within 72 hours. And of course, for that, we have the medicines and consumables pre-positioned already. It's in place. We have staff trained, and we are also working with the CSO and NGOs, youth organizations, even the student bodies, so that the need for volunteers can be handled, because only the medical team cannot work. So we have worked with these organizations also. And many a times, Family Planning Association of India is looked upon as an agency working only in the field of family planning or contraceptives or birth control. But apart from what we do for sexual reproductive health, we also want to, inform that we are prepared for any humanitarian response activities. Staff, our staff number is very less currently. Depending on the projects, when we culminate a project, then the staff goes away. This is the perennial problem being a voluntary organization or in the NGO sector. But currently we have doctor on call, we have nurses, we have lab technician, we have a program officer as in her, then we have the basic staff that is necessary for running an NGO. So and we all do multitasking. Now you may be thinking I'm trying to avoid the number, isn't it? The number is coming to my brain. Six staff currently we have, and like we say with the International Planned Parenthood Federation policy, which we are member association. This is our work is on voluntary basis. So we have many young people who runs our programs as well. For example, this is away from humanitarian response thing, but for example, we have a program called TopX. TopX, if you search the Instagram, it is active on Instagram because it is run by young volunteers only. So TopX is one program where we used to have it on all fourth Saturdays. November 4th Saturday would be our last. December festivities comes in. So on all fourth Saturdays, we have all performing artists invited, particularly from middle class, let's use the word middle class people, or opportunities that don't come easily to those group of people. We give this opportunity to them, and they come and perform on all fourth Saturdays. And we are very active. I mean, the youth volunteers who are running this are very active on Instagram, Top X. First place, Family Planning Association of India, as the name, many people think that we are only working for family planning. Our concept of family planning, of course, is different again. Ours is not, not about population control. We need more population in Nagaland, but ours is about quality population, people who can grow up to become citizens of a society. That's our concern. But apart from that, we also work with young people, and we have specific programs for young people in schools and colleges, and also non-formal sectors. Then we have the humanitarian response activities that we are having this media meet now. Then we are also looking into climate change, because it is this climate change that we need to understand the dynamics so that we are able to avoid natural disasters. Man-made disasters different, industrial disasters different, but natural disasters are things that we can avoid if we are conscious and aware about climate change as well. So we always say we are, working for sexual reproductive. Even in our letterhead, we write working for sexual and reproductive health. But many people still tend to think that's not their fault. That's our problem with advocacy, I guess. Many people still think that we are only working on family planning. As part of a spring project, that's the Humanitarian Response project. As part of that, with this media meet, this is the 14th activity that we have done. Just focus on the spring project. As the branch, we do many other programs as well, but focus on humanitarian response. We want to be able to tell the society and the people in authority that family planning also has resources, trained, capable to handle sexual reproductive health needs of people in emergencies. We also want to tell people and people in authorities that sexual reproductive health services is essential in emergency crisis situation, and this need to be incorporated. And for that, we are prepared and we have the resources to be able to, would it be the right word to use, complement or supplement, I don't know which, the efforts of the government and the authorities. Yes, independently. We have our own resources available, and the team is trained to handle the sexual reproductive health matters with regard to minimum initial service package. MISP is used, that principle is used during emergencies. That time in emergencies, we cannot have a hospital-like services available for people in the relief centers. So minimum initial service package is given. There are many components there. These services are given so that we can save life, so that there is less maternal morbidity or mortality, or even the infant morbidity or mortality, less transmission or possibly prevention of STIs and HIVs, and most importantly, sexual gender-based violence can be avoided. So these are very important, and in a crisis situation, young people, particularly women and girls, you know, they are more vulnerable and more at risk. So using the MISP principles, we can provide sexual reproductive health services. And we have a team set already. So for the East India sector, that would include Orissa as well. But Orissa is very popular with its own cyclones and storms and all those things, so they have an independent team there. In the West Bengal, we have another team, then that is part of West Bengal, but near to northeast, that is Kalchini. So there is also one team, and here Nagaland branch is one team. So Nagaland branch being nearest to Manipur, we're taking care of Manipur. And if anything happens in Meghalaya, then Nagaland branch will have to go and take care of those things. So independently, our trained staff, our own resources, we will be able to go and help and assist. But like we said, there is that difference between us and the Disaster Management Authority. Disaster Management Authority have many roles to play, but their role basically is first respond. For us, is after the first emergency. When people are in camps and relief centers, that's when we can go and serve.
In the MISP, apart from human resource readiness that you have, what are the
medicines? In the MISP, we need to have medicines and consumables ready, and we need to have the team of medical people. That would be doctor, nurse, lab technician, and counselor. Most key, most important. Depending on the size, we may have one doctor, or maybe we may have 2 or 3 doctors, and nurses and counselors. Just Nagaland branch personnel just got trained 2023, and we started actively working in 2023 only. And we have not, in the earlier times, we have not, gone to the disaster management authorities as well. But now we also want to let the disaster management authority know that we have the capabilities and resources. And so we have started meeting the people, the stakeholders. And we have also met up with the medical authorities, as in the district level, the CMO. We have also met up with the SDRF team, and of course, timely we are conducting media meets like this. In this regard, this is the second media meet that we are doing, and we have also, in our small ways, tried to train and bring awareness to NGOs, CSOs, and even student bodies as well. So we couldn't reach out to many, but there are so many here in Nagaland, but in our own level, we have tried to reach out to them through meetings and trainings, orientations, and sensitizations.